You all hear me? Oh, wow. You all can hear me. Welcome to this afternoon session and to our four speakers who are with us today. We will go through each speaker and give some time for questions after each one. And then if we have time at the end, we can ask additional questions. So we will start with the first presentation. And I will introduce Rizka Maulida, who will come up and do her presentations on environmental correlates of adolescent active travel to school in Asia and ecological study. Thank you.
Greetings, everyone. My name is Rizka Maulida. I'm currently a PhD student at the University of Cambridge, based in the MRC Epidemiology Unit. I will be giving a presentation on one part of my PhD, which is the active environmental correlates of adolescent active travel to school in Asia and ecological study. Okay, so 80% of adolescents are insufficiently active, as defined by the international guidelines of physical engaging in 60 minutes of moderate to vigorous physical activity, and their physical activity tends to decline as they grow older. And studies have reported that health benefits gained from physical activity in adolescents are carried forward into adulthood. Children and adolescents who actively travel to school are shown to be more likely to be physically active. And according to the ecological model of health behavior, factors at multiple levels can influence health behaviors, and past studies have shown that active travel to school is influenced by both individual and environmental level factors. So the trends in Asia, many low and middle income countries, including those in Asia, experienced rapid urbanization that led to a shift in daily travel patterns towards an increase in reliance on private motorized vehicle. And as many of these countries develop and increase income levels grew, motorized vehicle ownership increased, and which much of the infrastructure geared towards new roads, subways, and flyovers, thus making motorized vehicle more desirable, and there's an increase in reliance on private motorized vehicle across these countries. With the increasing of use of private motorized vehicles, travel-related physical activity is decreasing and is expected to continue to decrease further from 2020 to 2030. Additionally, many Asian cities also dominate the top 20 of most severe air pollution globally. This is where active travel promotion can help increase physical activity, reduce road traffic injuries, and decrease air pollution, especially in heavily populated areas. In our previous study, it was shown that 55% of Asian adolescents are actively traveling to school. We also found that among these Asian adolescents, older and male adolescents were more likely to actively travel to school. However, the main contributors to country-level differences in adolescents, active travel to school prevalence remains unknown. Therefore, this study, the primary aim of this study was to examine the association between prevalence of adolescents' active travel to school and country-level environmental correlates in Asia. And a secondary aim was to examine their association with country-level differences in active travel to school by age and sex. Now we're moving on to the methods. We use ecological study design with country-level variables, and these are the dependent. We have 3 dependent variables. The first dependent variable is the country-level prevalence of adolescent active travel to school, difference in prevalence of adolescent active travel to school by age group, difference in prevalence of adolescent active travel by sex. And these data come from the global school-based student health survey developed by the WHO and CDC. And it is a school-based survey conducted mostly among students aged 13 to 17 years. And it used a 2-stage cluster sampling design to obtain a nationally representative sample of the adolescents and use standardized sampling and data collection methods. In our previous study, we generated prevalence of adolescents active travel to school, as shown in the previous map, and we used the prevalence from these 31 countries in this ecological study. And this is how we obtain our independent variables. It was sourced from various publicly available data sets, and through a selection process, we selected 11 country-level environmental correlates for the independent variables. And these are the independent variables, and they were divided into two physical environment and social environment, with 8 physical environmental correlates and 3 social environmental correlates. For the statistical analysis, we use simple univariate linear regression models, and it was run to obtain estimates of association of each dependent variable and each independent variable. We standardize all independent and dependent variables to have a mean of 0 and a standard deviation of 1 to ensure estimates could be compared equally. And we're moving on to the results. So we found positive associations between prevalence of active travel to school with temperature variation and elevation variation, meaning that greater country level variation in temperature and elevation was associated with greater prevalence of adolescent active travel to school. Meanwhile, urban population percentage, nighttime light, secondary school enrollment, and prevalence of insufficient physical activity in adults all showed negative associations, meaning they were associated with lower prevalence of adolescents active travel to school. We also found negative association between the difference of prevalence of active travel to school by age with car per people, meaning that greater country level car per people was associated with relatively smaller difference in prevalence of adolescents active travel to school by age. We found positive association between the difference of prevalence of active travel to school by sex with PM2.5 concentration and prevalence of insufficient physical activity in adults, meaning that greater country level PM2.5 concentration and prevalence of insufficient physical activity in adults were associated with a greater difference in the prevalence of adolescent active travel to school by sex in favor of more male adolescent actively traveling to school. Now we're moving on to the discussion section. So there were 2 notable findings in the study. For physical environment, in countries where more people live in urban areas, the fewer the adolescents engaging in active travel to school. And for social environment, in countries where support of physical activity measured by prevalence of insufficient physical activity in adults is low, there are fewer adolescents engaging in active travel to school, particularly with fewer female adolescents compared to male adolescents. So for physical environment in this study, greater country level urban population percentage and nighttime light were associated with lower prevalence of adolescents active travel to school. This was also complemented with suggested country level car per people's negative association with active travel to school prevalence. This results, however, does not follow the common understanding where high concentration of people living in urban area usually indicates that the place is compact and the distance between destination is shorter, thus making it more active travel friendly and accessible. This may be due to the poor infrastructure development in many low and middle income Asian countries, and since owning a car is more desirable in these countries, many infrastructure development were made for cars. We should also note that in many Asian low and middle income countries, even when distance is large, many have no choice but to walk or cycle, as these are the cheaper options. Of note, our study also showed that increased car ownership was negatively associated with prevalence of active travel to school by age. And it suggests that as the number of cars per people increase, the difference of prevalence of active travel to school between older and younger adolescents decrease in favor of relatively more younger adolescents engaging in active travel to school. This may be because once older adolescents are eligible to have driving licenses, they would prefer to drive their car or motorcycle to school. And the legal age for driving motorized vehicle in several Asian countries is as young as 16, especially for motorcycles, and 17 years old for cars. Additionally, secondary schools are often further apart than primary schools. because there are fewer secondary schools than primary schools, increasing the need for motorized transport because of the distance. For social environment, prevalence of insufficient physical activity in adults was negatively associated with prevalence of adolescents' active travel to school, but was positively associated with the difference in prevalence of active travels to school by sex. This indicates that as country-level adult physical inactivity prevalence increases, country-level active travel to school prevalence decreases, but sex differences increase in favor of more male adolescents engaging in active travel to school. This is consistent with the observation that in countries with low physical activity and high activity inequality, the gender gap in activity is amplified. Secondary school enrollment was negatively associated with country-level prevalence of active travel to school. One possible explanation is that areas with more adolescents enrolled in schools may have more facilities to help them get to school, such as school buses, and making walking and cycling to school less desirable. Alternatively, this could be because there are fewer secondary than primary school, as mentioned before. The secondary school are further apart, making active travel to school less feasible. So in conclusion, the study shows that Asian countries with a greater number of people living in urban areas, lower levels of overall adult physical activity, and higher levels of nighttime light have a lower prevalence of adolescents' active travel to school. And country-level physical and social environmental correlates explain some differences of the regional variance in active travel to school. Therefore, future policy action should an intervention for the region need to be contextually sensitive to the environmental correlates that vary between these countries. I forgot to include the strengths and limitation. I'll just say some really quickly here. So in this research for settings and where ethnically collected individual data and on active travel and its potential correlates is lacking, this study was able to provide macro level description of the relevant environmental correlates of active travel to school. And the study used a pooled comparable estimates from active travel to school from 152,368 adolescents from 31 Asian countries, and data were collected using standardized sampling and data collection methods, enabling comparisons across countries. However, as we know, analytical power was limited as observations were limited to 31 countries. And thus the level of association might have been underestimated. And years of data collection for the independent variables were not perfectly matched due to data set and availability. And such aggregated scale of analysis is often related to the issue of ecological fallacy. Thus the result generated from the study should not be applied to individual level contexts. This work is part of my doctoral study, which is funded by the Indonesia Endowment Fund for Education, Ministry of Finance, Republic of Indonesia. Thank you.
Great presentation. Thank you so much. I was really struck by the night lights.
Nighttime light.
And I missed your explanation of why that might be, but could you talk a little bit about sort of why that would have a negative association with walking and like what we should draw as a research community or as policymakers in terms of, you know, what we should do about it?
Okay, so in here I use nighttime light as a proxy for urbanization. I was just going to use urban population percentage, but that doesn't really define the urbanization because it's just counting the population, not the infrastructure itself. And then I was trying to look for a proxy for infrastructure that define urbanization, and after much discussion with my co-authors, we decided to use nighttime light because it defines electrification of, for example, a city or an area in, let's say, in a country. And with electrification, usually it comes along urbanization, infrastructure urbanization. Thank you.
Thank you.
And our next presentation, please. It's very suspenseful when you wait. Our next speaker is Carlota, who will speak about integrating health and housing policy and neighborhood transformation project. Thank you.
Where's the clicking thing? Oh, here, next. Okay, thanks. Hi, good morning. Delighted to be here. I'm presenting this project on behalf of my colleagues from the Barcelona Institute for Global Health and from the Provincial Council of Barcelona. I'm presenting a project that we've been working on since 2020 on how to better integrate health in housing policy and neighborhood transformation projects. And so, sorry, like how much? There you go. Okay, so we spend the estimates pre-COVID pandemic were that we spend in the current context of Europe around 70% of our time at home, and so it affects our health in many ways. Some can seem relatively minor, but in total, it does form one of the key social determinants of health. And so the World Health Organization estimates that around or more than 100,000 deaths and illnesses every year in Europe are due to inadequate housing conditions. But what do we actually mean with inadequate conditions? Well, on the one hand, of course, it's structural soundness, materials being not deteriorated, but it's also being able to reach thermal comfort in the winter and to not be exposed to excessive cold, and also in the summer being protected enough from the heat. It's also not having damp environments that will lead to mold and therefore to inadequate indoor air conditions. But it's also in terms of whether a house is adequately laid out, functional, accessible for the needs of the users, if it's large enough for the amount of people that live there and therefore does not lead to situations of overcrowding. And housing is not just about the physical dwelling, but also on aspects such as does it provide enough privacy and safety, perception of safety, and also is it adequately located? Is it well connected to opportunities for job, for education, access to green space, to public transportation? And so, as you see, there are many different dimensions to housing, and in fact, the World Health Organization defines 4 housing dimensions, which are the home, in understanding this as the cultural, social, economic structure of the household, then the physical dwelling, the immediate physical environment, meaning the block, but also the neighborhood, and the community in the sense of social environment, the population, social network support, etc. And of course, these 4 dimensions are quite interconnected, but also connected to a number of health risk factors that are associated with inadequate housing. This is just a few examples of this. So, of course, we also find out that when we explore the links between housing and health, great inequities reveal at every step. And so we know that providing better access to adequate housing, whether it's through new build, but especially in the European context that is so already built up, we need to, like, the efforts to renovate and with health in mind, the existing housing stock is really a tool for better health equity and environmental justice. And so what has been done so far in terms of healthy homes policies? Well, there has been some initiative in this, mostly focused on improving energy efficiency in buildings and in homes. And although these could bring many benefits in terms of reducing the energy bill and also improving thermal comfort and even creating green jobs towards the future, it's of course not addressing the full picture of the links between housing and health. So also what we found is that many housing policies are not directly formulated with health protection as a central requirement. And most of this can also be, well, reasoned under the idea that we let's say healthcare costs, or the reduction in healthcare costs, the potential reduction of renovating or improving our homes is not integrated in the sustainability economic model. And so what we find from the very few models that we have is that it makes sense money-wise, but often because the competencies are very spread out and they're at different administration levels, we find that we really don't take that into consideration. So two common barriers for policy implementation of healthy homes, parameters, and criteria: lack of multisectoral collaboration, and also a lack of scientific evidence informing context-specific housing policy. And with these two common barriers in mind, we started working, as I said before, since 2020 on a multisectoral collaboration that could bring together multiple visions, dimensions, and competencies around housing and health. So from the Urban Planning, Environment, and Health Initiative at IS Global, we have been working with the Provincial Council of Barcelona, and specifically with the Housing, Public Health, and Social Services. And if you remember the four dimensions that I mentioned before of the housing, we started with the first phase addressing the physical dwelling, and during a second phase, addressing the other three dimensions of the home, and immediate environment, and community. And so we started out by mapping which were the actual elements that we wanted to pay attention to. And so we decided we would do a literature review of these different elements. So as you can see in the first phase, we addressed 14 elements under the three big groups that we called thermal comfort, environmental quality, and also spatial quality and functionality. And some of these were also scaled and translated to the second phase of the neighborhood scale. But also included other aspects such as the urban model, green space, mobility, and other more social aspects such as access to housing, social perception, participation, and other formulas of housing such as co-housing, senior co-housing, co-living, those living structures, and whether there was enough evidence that could support like the links to some certain health outcomes. And so, of course, we agreed on a search strategy and conducted the literature review. And during the presentations, we wanted to address three basic issues, which were, let's identify which were the most relevant factors affecting health in the European context, of course, in the home, and also whether there's evidence of poor housing conditions impacting physical, mental, and social health of the residents, and also which housing improvements have documented positive health benefits. And well, it's an ongoing process, and we're still working on it and seeing where it goes, but we have a few outcomes and impact that we would like to share. In general, I'd say that we have seen a very increased awareness among local officers, which has also led to further motivation to sort of extract from the results of these reviews criteria and parameters to promote healthy homes, going beyond the compliance with current building codes. And so specifically for phase one, apart from making a report, establishing a report that is open access and that you can actually download here right now. It's just in Spanish, but we're waiting for translations. Also, in terms of housing renovation and retrofitting, we have created a guidance document for municipalities that includes also information on health risks of inadequate housing conditions and on the potential of certain measures to protect and promote health. And in terms of building new homes, which, as I said, is a smaller part of what we should be doing, but even so, it should be also addressed. It's interesting that we, for the bidding documents, for architects, builders, developers to actually get public contracts for homes, they will have to include mandatory design aspects linked to health protection that go, as I said, beyond building building codes, especially in terms of protecting from excessive heat gain in the summer, and through passive measures, of course, not depending on air conditioning, and also a few other aspects like introducing sunlight, and I can discuss further if any questions come up. And for phase 2, a similar report is about to be launched, but about the literature review about the other 3 dimensions. And we've been focusing mostly on extracting from the results of what could be focused on disadvantaged neighborhoods. And we have started now a collaboration with certain municipalities to better integrate or further integrate the health perspective in some of the ongoing or just starting neighborhood transformation projects that they're working on precisely in disadvantaged neighborhoods. So as I said before, it's an ongoing process, but this is to where we at so far. And thank you for the opportunity and for your attention.
Thank you so much. Are there any questions from the audience? Yes.
Thank you. Oh, that's loud. I just wanted to check what led you to actually create something like this. Was there a need to create that kind of work? And how did you start?
How the collaboration started?
Yeah, exactly.
Well, it was actually motivated mostly by the provincial council. They already had this sort of interest in, let's know what the healthy homes really are about, because I don't know, especially during the pandemic, well, when we were all confined at home, and the experience was so different for certain people depending on where they were living. Well, there was this interest from their side. And so they decided to sort of bring us on and sort of start this collaboration and really find out where should they put their efforts and I mean, of course, our efforts and resources are limited. And so where should they really be focusing? Where does the evidence lead you? And when talking about healthy homes and like the links between health and housing.
Yeah, COVID initiated in a way. Yeah.
Sure.
Thank you so much.
Sure.
Hello, thank you for your presentation. As we know, especially in Latin America, we know that we have very different relationships with household chores related to gender. So I would like to ask about if you thought about it and how is it addressed? Thank you.
Yes, thank you. It's something that in the review we also added as a sort of we tried to like bring together as much evidence we had like on these different topics that we were addressing, but was there sort of a gender lens through which we could analyze it as well? I'd say it came up especially when talking about energy poverty, because usually the data that we have on energy poverty is not like separated between gender. And what we find is that it does have a feminine face in the sense that women are usually more exposed to the health risks associated with energy poverty, because they spend more time at home and for several different reasons. And so we find it there. And well, and some vulnerability also in terms of noise and light, we did find a few things, but still, like I'd say not extremely conclusive yet. So, but it's certainly a lens through which we can analyze most of what we have done so far. It wasn't the main objective, but of course it's something to consider.
Thank you, Carlota. I'm Philippa from New Zealand, and we're doing a very similar project. So I was very excited to see yours. I like the linking of housing with health and energy and other well-being outcomes. Have you a way of measuring those other things by using, say, administrative data? Do you know that your program is working to improve people's lives and health?
Well, we still, yes, thank you. This is something that we still have to work on. I mean, we're in the initial stages of the process, but it would be very interesting to see actually what impact or what effect, like to evaluate really what these like translation from the evidence to different policy proposals, whether they are having an impact or not. I mean, we would probably have some data in the near future after our collaboration with specific municipalities on specific projects, which I said, as I mentioned before, during the last part of our second phase is working on that, but it's still in the making. I mean, yeah, it's something to keep in mind.
One last question.
Thank you. Very excited to see housing presentations. I'm representing an organization called Think City in Malaysia, and we've also looked at housing, but we've, in addition to our own initiatives, we had a similar approach in trying, because of the fragmented services and approaches, trying to set up a public housing partnership and just creating a synergy between everybody who from different health perspectives or economic development perspectives wanted to improve the lives of people in social housing. And so just setting up a partnership, and I'd be very keen to have a chat afterwards to see just what are the issues that are emerging by bringing different parties together in to develop a program, not necessarily built on the evidence on urban health, but where are the synergies and where's the funding and where's the motivation as a starting point for housing and health? Thank you.
Yes, thank you for the question. I'm definitely looking forward to a conversation later on. Yeah, so for now, it did flow quite well. I mean, as I said before, the Provincial Council was already quite motivated to work on this. And so we didn't find those many barriers or but it would be interesting and probably a little more challenging when we get to how the municipalities that the regional council are trying to work with and sort of guiding through these process, how they are actually finding the implementation of these measures. And so, as I said before, since it's in the initial stages, all these questions should be answered or at least addressed. And anyway, thank you.
Thank you so much, Carlota. We look forward to coming back next year and telling us all how it all turned out. Our next speaker, Yu-Chun Hsu. We'll talk about Rural Regeneration Program, actually enhance community empowerment in rural community, a case study in Taiwan.
Hola, good afternoon, everyone. Thank you all for being here. I am Professor Yu-Chun Hsu from the Department of Urban Planning at National Cheng Kung University in Taiwan. Today, I am very appreciated to present my proposal about the Rural Regeneration Program, actually enhance community empowerment in rural community, in a case study in Taiwan. First, what is your imagine of the rural community? Is it just farming, desolate, aging, or other else? Unfortunately, in this area, the rural community faces as multi-dimensional recession, include economic, societal, and environmental challenges. But why? Why cause the phenomenon? The main reason is because the extreme on urbanization. As you can see in this program, the graph, the number of people living in the urban population exceeds the rural population. It changes the rural community, society, and economic structure. The function of rural area could not meet modern development needs. In addition, rural strategy and the declining industries and also accelerate the inconvenience of rural community. And how about my hometown, Taiwan? Taiwan also suffers from urbanization to impair rural challenge. Taiwan's metropolitan area gathers about 69% of population, but even in urban area, uneven development causes rural region to be disadvantaged. The unique challenge is that Taiwan has many informal factories. It is about building industrial plants on farmland without legal registration. It could cause the problem like farmland pollution, poor agricultural production, and so on. Last but not least, Taiwan is an island state surrounded by sea, so it is less land to grow crops. It could cause a low food self-sufficiency rental and dependent on imports. So we need to pay more attention to the problem of rural areas. The answer to challenge is the many governments must promote rural regeneration to re-evolve the value of rural areas. Rural regeneration is frequently encouraged using a community empowerment approach to be more concerned about self-motivation, public consensus, and and health promotion. So while initiating community development, we must focus on the policy and or planning that benefits and enhance community empowerment. Taiwan promotes it in 2010, including 4 projects: environmental production activities, cultural conservation, and ecological conservation. Therefore, Taiwan has promoted the program for more than 10 years and has devoted resources to hundreds of communities. But while we still facing rural challenges, it is the first question for us. And to overview the programs, it hasn't evaluated community empowerment yet. It could cause we can view the long-term capacity review of the programs and inspect rural development. So the second question of the study is whether the community participates in the rural regeneration programs or not. Is there a significant difference in its empowerment? Hence, this study analyzed the impact of programs of empowerment of rural community. Use the indicator to compare community empowerment state 5 years after program implementation. And study area will be in Tainan, Taiwan. It continues to implement program to achieve sustainable rural regions actively, and also the most intensive production based in Taiwan's main agricultural production area. It is the best city to represent a rural lifestyle, agriculture, and culture. We select the 7 indicators for the evaluation, include about community empowerment indicator. The study looks like to the contents of rural regeneration programs and then consider the purpose of the plan. The study add and delete the community empowerment index proposed by the NGO We World 2020. And then we select the 7 indicators for the evaluation, include the employment opportunity, income status, community event, access to information, political participation, industrial type, and the vote obtained. Finally, the data shows that the empowerment have promoted in the program for 5 years has remained the same and even declined in some areas. But what is the cause, the reason? A result, focus on the decline community Focus on the decline community in 2020. The apparent indicator of decline are employment opportunity, income status, and access to information. Remarkably, the indicator of employment opportunity. First, it could be the super edge community in rural areas. For example, this Huanghu village, because the super edge is caused the poor access to information, and so on. Secondary, it could be because almost all the rural area in Taiwan is farming for living, and its single crops is primary source of income. The rural population still have low income status and the lack of employment opportunity, and more general environmental trends cause the rural regeneration program could not have a significant impact on the rural community. Then I want to review the main points. After preliminary research, participation in the rural regeneration program could not enhance community empowerment directly. Many factors can influence it, like the societal trend or the force of urban or other else. So what is the factor that impact community empowerment? Now it is an open question that we can discuss, and it will be the issue for my future master paper and try to analyze. It is the end of my oral presentation. Thank you all for your attention. It is my pleasure being here today. Thank you.
Is this on? Thank you so much, Yixing. I have just a comment, which is I think the combination of combining actual quantitative measures of empowerment with going face to face will bring this together beautifully. That'll be wonderful. Any other questions from our audience? Hey, thank you again.
Thank you.
It's wonderful. And our last but not least, final speaker, Brent Langellier, also my colleague from Philadelphia, talking about systems thinking to define, understand, and address public health challenges.
Hi, thank you so much for coming. I just want to get a sense of the room. Could you raise your hand if you've heard of systems thinking before? I think we've touched on these themes kind of throughout the conference, yeah. And today I'm going to be talking about systems thinking generally, but I'm mostly going to focus on this method called group model building or community-based system dynamics. Has anyone heard of that? Okay, so a fewer people. But raise your hand if you think that health in cities is in some way a function of a complex system. Okay, so not as many as I would have expected, but still quite a few. So I hope to convince you. So I'll just talk a little bit about some general systems background. So a system we think of as a set of elements or parts that's coherently organized and interconnected in a pattern or structure that produces a characteristic set of behaviors. And I think a lot about examples of this. And I think a really good example would be a transport system, right? So in a city, there's usually a pretty complex interconnected grid of different modes of transport and different sort of networks, road networks, rail networks, and all of these function together in a way to produce a characteristic set of behaviors. And we, as the people that take that transit system, have expectations for how that system works, right? So if I'm trying to get from the hotel in Valencia to the conference center, I understand that I can walk there and I can go along sidewalks and roads, or I can hop on a train or on a taxi and get there in a defined amount of time, right? But I'm not the only person using that network. There's also other people. I have some expectations for how they're going to behave and how the system as a whole is going to function, but it is interconnected. It does have a characteristic set of behaviors, which is to get people from A to B in a somewhat efficient manner. So that's a system, it's a real thing, but we also make models of systems, right? So you've probably heard this saying that models are always wrong, but some are useful, right? I think another way to think of a model is that it's a purposeful representation of some real system, but it's necessarily an abstraction. A model is never as specific as the system itself. This is a model of the transport system in Philadelphia. It's fairly complicated, but it's definitely useful, right? Like I can look at this and see, I'm starting off around here. I can take the train to my workplace, for example. So this doesn't have all of the information of the actual system. It doesn't have all of the details, but it's still incredibly useful. So that's a model. And then I think the thing that I want to focus on today mostly is mental models, which is a cognitive representation of a real dynamic system. So in my head, I have expectations for how a piece of a system functions, right? So I commute between my house in Philadelphia and my workplace. And so I have a really sort of nuanced understanding of how to get from A to B via rail or via bike, but I have a much less sort of general understanding of basically every other part of this transport system. But I think the important thing to realize is that, you know, I only see one chunk of the actual system, but there are people that live in other parts of the city or that commute via different modes or that actually work in the transit system, and their perspective is quite different. So if I wanted to make a map of the entire system to understand how it functions as a whole, my little chunk of it is not really sufficient understanding to do that. I really need to talk to different stakeholders, and that's what these methods are really good for. Okay. So what makes a system complex? Well, these are all things that we've talked about, actually. We think of health in cities as this multi-level system, right? Where there's multiple different types of actors. We have people that move about and interact within a system. We might have food stores, organizations, we have policy-making entities, right? So these are all multiple types of actors that are sort of behaving autonomously and independently. We have multiple levels of aggregation. So we have people that live in neighborhoods. So a person has income, but a neighborhood has a poverty level, for example. These are really important determinants of health. And then we have social networks. So what I do influences what you do, what we as a city, sort of our social norms related to eating or transport impacts the infrastructure, impacts the behaviors of other people. So there's also this really interesting sort of dependence. And then a really important one is feedback loops, which is a closed chain of causal connections, but we think of these as sort of two main types. One would be a reinforcing feedback loop. So vicious or virtuous cycle, I think probably everyone has heard of that. Cycles of poverty, for example, would be a reinforcing feedback loop. We also have goal setting or balancing feedback loops, which work more like a thermostat. They sort of prevent a variable in a system from running out of control. And I'll be presenting on basically work that this entire team, Salón, has done in Latin America. This is a wonderful collaboration of institutions and people across countries to be involved with. And we have this systems thinking aim, and really that's to understand what are the complex systems driving health in Latin American cities. And we really focused on diet and urban transport. Latin America is really at the forefront of some very interesting policies related to both of these areas: bus rapid transit, food taxes, labeling, restrictions on advertising as a couple of examples. And we have a paper related to this work as well. So I'll just give a kind of high level overview, but basically group model building is a qualitative systems thinking method where basically we get groups of stakeholders from different sort of places in a system into a room, and we really sort of try to give them the language to speak about the complex systems that they are embedded in or work with. And it essentially is a series of scripted activities. So if you look at the sample workshop agenda at the right, we start with a hopes and fears sort of icebreaker exercise. Then we go to graphs over time, which is this method for getting people to think about how a system, an important variable in a system will change over time in a hoped for scenario. So like, I hope that consumption of ultra processed food sort of stays stable or goes back down, but I fear that it's going to continue to go up. This is a really good exercise because it gets people to think counterfactually. Like, what is the thing that would cause my hoped for scenario versus what is the thing that would cause my feared for scenario? And then kind of the culmination of these exercises is causal loop diagramming, which I'll spend a little bit of time on. This is generally what it looks like. you get in a room with a group, you have a facilitation team, and you walk people through these exercises, and you produce artifacts or outputs in each of these exercises that you can then analyze and sort of look at to increase understanding of the system from different perspectives. This is an example of graphs over time, and this is what you sort of end up with is every stakeholder produces 2 or 3 of these, including their hope for and feared trajectories, and you have this sort of stack of variables that are seen to be important for the system. So in a causal loop diagram, has everyone heard of a causal loop diagram? Yeah. So this is a causal model, but it's a little bit different than like a directed acyclic graph or DAG that epidemiologists might be familiar with, because the arrows go both ways, and that's really important for describing feedback loops. Our prompt for this was to build a causal loop diagram that explains a hypothesis related to food or transport in a city. And we have people do these in small groups. The causal loop diagrams look like this. So each one of these words is a variable that influences diet or transport. And each one of these arrows is a posited causal link between the arrows. We then go through a kind of reconciling process. And we end up with this synthesis model, which is really an aggregation of all of the small group causal loop diagrams across the 3 sessions that we did. And you can see that there are some really interesting feedback loops in here. I'll leave this up for a second, but for example, if you're really worried about ultra-processed food consumption going up in a city, you might think that these feedback loops are really important. Notice that most of these are reinforcing feedback loops, which again are vicious or virtuous cycles. So you could see if there are several reinforcing feedback loops in here, it seems very reasonable that ultra-processed food consumption would sort of cycle out of control if we don't make changes in the system. So for example, a big thing was that UPF consumption drives sales, right, which drives revenue that companies then sort of reinvest back into the system to sell more ultra-processed foods. And they do that by advertising. They do that by lobbying against some of these regulations that cities have tried to pass. And so we need to disrupt that feedback loop, right? And if you look at this and you think about these different feedbacks and how they interact and how they work in combination, it really makes sense that some of these health outcomes are cycling out of control. And it makes sense that they're hard to intervene on, right? That's sort of the take-home message, I think, is that if you have a complex system, if you have these wicked problems that are defined by, driven by feedback loops, you're probably not going to make that much of a difference by just sort of tweaking the level of a variable, by increasing the price of ultra-processed food by 8% or something because of these feedback loops. They're going to continue to make changes to sell more and more and more food, as the economic incentive increases for companies. So the group maps this complex system, sits back, looks at the map, considers these feedback loops, and then we go through this action ideas script where basically they say, given these feedback loops, given how we all think about the system in these different ways, what do we change? What do we tweak about the system? What feedback loops can we add? What can we break? What variables do we need to change? And you get this list of really interesting action ideas. But I think the thing that I would leave you with to make this a little bit more general is that we all work from different perspectives, right? We all have different areas of expertise. And we are all generally, as people in urban health, working within systems that are in some way characterized by feedback loops, wicked problems, balancing feedback loops as well. So I think that this is a generative process. It's good for understanding and identifying causal connections. It's good for identifying feedback loops. But I think the thing that has been impressed upon me the most is that it's also a really good exercise for understanding how other people view the system so that we can develop consensus about how to intervene, what policy changes to make, so that we're asking the same questions and sort of getting to the same answer. And so I think it's a really good sort of consensus building exercise as well. And for those of you that are doing policy work, I would say that using these tools with your collaborators, with the networks of people in your city that are kind of working in the same area is really powerful. It's a really great way for people to sort of make sure that they're working from the same mental models so that they can all agree on how to intervene in the system. So I'll stop there. Thank you.
Any questions? Actually, I have one. Then you want to come down. Have any of the last slide that you put up, or the second to last slide on interventions, has any work happened on any of those interventions that came out of this modeling process?
Yeah, that's a good question. I think we would have to go back to the city stakeholders to figure that out. And probably somebody else at Salón has the answer to that more than me. But I think one of the things that we used this for was kind of as a fuzzy input for the other types of modeling that we're doing. So we are developing additional models to look at some of these feedback loops and some of these influences on diet and transport separately. We're sort of developing simulation models of both of those systems.
Right, terrific.
Well, that was a really extensive, interesting work. I have a question about the policy interventions. At what scale are all these policy interventions occurring at? Is this the city scale, neighborhood scale, or do you also concern yourself with more federal regulations and interventions?
Yeah, that's a really interesting question. So we had policymakers from all different sort of levels and from different countries. So I would say the emphasis on Salón is really about like what drives health in and across cities. So we're really thinking about policies at different levels, but there are evaluation efforts related to things that are happening in specific neighborhoods, like the parts of the transport system. Some of the Colombian team has done really great work related to that, but I don't. I think less of it is at the national level and more of it is city and neighborhood level, but for sure, they're also looking at things that are federal.
Sure.
Do you sense if the scale is more local, do you sense there's a greater opportunity for engagement among the stakeholders you are actively engaging in? And do you think like the engagement process is actually kind of changing their minds or toward
Yeah,
policy?
This isn't the only project that we use this in. And I would say that one of the things that's really stood out to me is that the stakeholders, once they agree to participate in these, are incredibly enthusiastic about this sort of way of thinking. People really have an intuitive sense of feedback loops in particular. And when you give them sort of the language to talk about that and describe the tools to describe them, like we've had people from the Latin America workshops come back to us and ask to learn the methods to use them in their organizations. So that, that's just sort of anecdotal evidence, but I do think that the level of engagement is high. And I wouldn't say that any particular like type of stakeholder has been more amenable to doing this work. I think it's mostly about getting people in the room.
Well, I'd like to thank this fantastic panel. You guys are all this is really interesting work and different things, and we clearly have a lot to think about. And thank you all for joining us today.